Tell us what you think. In person, over the phone, online. Watch and hear yourself on TV. You tell us, we air it. This is The Local Live.
Good evening, Larchmont and Mamaroneck. I'm your host, Mike Witch, and with me is Maura Carlin. And you are watching a special edition of The Local Live. Tonight, devoted entirely to the school-based health center proposed for Mamaroneck Avenue School. In recent months, differing opinions have emerged in the Mamaroneck community about a proposal being studied by the Mamaroneck School District to create a school-based health center run by the nonprofit medical provider Open Door in the Mamaroneck Avenue Elementary School. The school board and the district set up the Wellness Task Force to study the issue. Their report can be found on the district's website, and the school board meeting where it was presented can be seen on LMC TV's website. Currently, the district is in the process of initiating a more comprehensive needs assessment. We'll discuss the benefits and concerns raised by this proposal with school district parents, a nurse practitioner, and a representative of Open Door. But first, we prepared a video. Let's take a look at exactly what is a school-based health center, why the school board is considering housing such a health center at Mamaroneck Avenue School, and the community response so far to the proposal under consideration.
Not bad. We did a throat culture already, right? And it was negative. You think you could stay in school today? Because you don't have a fever.
At the Thomas Edison Elementary School in Portchester, a nurse practitioner tests for strep, performs physicals, and prescribes medicine to students enrolled in a school-based health center, a primary care pediatric clinic located within the school. There are currently more than 200 of these centers operating in New York State. And since May 2014, the Mamaroneck School District has been studying whether a school-based health center would be appropriate in a Mamaroneck district school.
Your risk might not be that bad if you can push up with it.
Portchester has 5 school-based health centers operated by Open Door, a nonprofit that has been providing health care to underserved, low-income populations in their community health centers since 1972.
Don't cough in people's face.
Take care of your body and yourself. Eat good food. If you have a virus or if you're sick, don't come to school because it could pass to another student or your friend.
Wellness education, preventative care, and acute care are provided through the school-based health centers. They serve a high-need population of students, many of whom are from low-income immigrant families. The school-based health centers are staffed by bilingual nurse practitioners. Their services are free and open to all students. There is no cost to the school district beyond utilities and custodial service. Besides well-child preventative care and sick visits, the nurse practitioners also focus on asthma management and programs to reduce obesity among the student population. Their efforts have produced measurable results with many fewer acute care visits for asthma and a dramatic decrease in missed school days. Other studies have also shown increased attendance rates for students with asthma enrolled in school-based health centers. The success of the school centers in Portchester drew the attention of the Hispanic Resource Center in Mamaroneck, which serves a similar population of low-income immigrant families and has long been concerned about a lack of health services in the community for families without private health insurance.
And so we're really talking about not having a medical home here in Mamaroneck, a place where you can access preventative care. And so we have urgent care centers. I believe we have 2 pediatric or 2 that serve have pediatricians on staff. It's a kind of a healthy alternative to an emergency room, but at the end of the day, it's not preventative care, right? And so you're not getting vaccines there. You're not getting well child visits. You're not really necessarily, those pediatricians don't have the time to invest in nutrition, education, the way that a preventative, visit, provides.
Last May, Open Door presented a proposal to the Mamaroneck Board of Education to establish a school-based health center in the Mamaroneck schools, offering to provide free health services to students with no cost to the district. The proposed site for the center was Mamaroneck Avenue School, a district school with the target population for Open Door services, a high concentration of children in poverty. A task force of school staff and parents was convened to research the health needs of the school community and learn more about the school-based health center model. On January 20th, the task force presented their findings to the public at a school board meeting.
MAS is an elementary school with needs. The highest population of low socioeconomic students in poverty, the highest population of free and reduced lunch, a high rate of absences when benchmarked against our other schools, and a high rate of students going to community-based health clinics for their medical care.
The research shows that there is financial hardship or inability for families of low income to miss work, single parents with no child care options, location and hours of providers, language and culture barriers, immigration status, lack or cost of transportation, gaps in insurance, and families may experience significant wait time for their routine and prevention.
We looked at the data from September of this year through December, and up to this point, MAS students visited the school nurse for asthma issue 89 times. That was a lot more than any other school.
Comments from school officials, task force members, and parents reveal differences of opinion about whether the school-based health center model is appropriate for Mamaroneck.
Mamaroneck Avenue School does a tremendous amount to keep our kids healthy, starting with a caring principal who knows what every kid needs, a nurse who is a nurse practitioner as well, who educates from a simple scratch to more serious problems, and she just gets our kids. They're sent home only when necessary, and even though our numbers of sent home kids may be higher than the other elementary schools, it is still low.
We don't have a community medical center here in Mamaroneck that is comprehensive. There are hundreds of families that have to go outside of the community to get care. For those without a car, it's much harder and very expensive.
A lot of the problem is getting the patients or the children to the sources, not necessarily that there aren't sources for them. It is there. It is available. One of the women was saying that it's difficult with respect to the pay and taking a train or something like that. A lot of these insurances actually offer vouchers to go to and from medical visits.
One of the things that I've heard about having the school-based health center is that the parents don't have to take off time from work or leave and wait to go to an appointment. Well, I work full-time because I have to work full-time in order to afford to live here, and it depends on your boss and your company of whether or not it's okay for you to take time off of work and be late for work. And I spend a lot of my times going to the doctor on Saturday because I do work full-time.
Isn't it our duty as a school district to, because we're in the business of educating, to educate about prevention and nutrition, instead of bringing in a company to put nurse practitioners there so that they can overprescribe and over x-ray and just feed the system with profit.
I know all of the health centers like Open Door in New York State, and I can tell you with absolute 100% certainty that they are not in it for the money. None of them are in it for the money. They are in it for mission to improve the health of their communities.
Another concern was the recent increase of the school population at Mamaroneck Avenue School and the potential of a health center in the school to exacerbate that growth.
There was mention of 180 families marked as homeless. How many additional families are we going to be drawing in homeless with a free health clinic in the school?
Some parents expressed concerns about the health center bringing sick children into the school.
The last place a child who is sick should be in is school. Having 3 kids in school, I am against health care within the school setting for this reason. I do not want my kids around other sick kids. Children who are sick should see a healthcare professional in a medical setting. Schools should remain a place of learning and not a healthcare facility.
News that Open Door was in negotiations to lease a site for a future community clinic right near the school raised more questions about the need for a school center.
If we're going to have a facility 2 minutes from MAS, that's the best news we could ask for. It's going to treat the whole family.
I think a community clinic would be wonderful. I'm not convinced it will happen in the near future, if at all. A community clinic addresses some of the barriers to health care, but not all of them.
I was very impressed, as I think we all were who were there, with the student-based health center in Portchester, and I could see how it could provide benefits to students beyond what a community clinic could offer, particularly with regard to chronic health conditions like asthma.
This is causing a huge divide in our school, and it's not something that people want because we always work hard to come together for anything. But I have to say that if this clinic comes into Mamaroneck Avenue School, my children would no longer attend the school.
We're going to ask more questions, get more information, and report back to the community.
While the ultimate decision whether to move forward rests with the school board, some Mamaroneck Avenue school parents are organizing in opposition.
I don't think anyone was ready for the backlash. We think it's a no-brainer. It's something that's good for the entire population in that school or the district, however they wish they want to shape this program. We did not think that there would be so much opposition to something that in our eyes was just obviously great for everyone. I think, you know, unfortunately, a lot of the folks that would benefit from this are really intimidated by the few that are being really vocal against it.
MAS parent Clorinda feels it's important to join the conversation in support of this program, which she believes would be helpful for her daughter.
She had very bad allergies and also find out she have asthma. And she was very, very sick. And the reason I'm very concerned is because this community is big. And why New Rochelle, White Plains, Portchester, every place have different place to go. Why not Mamaroneck have another have, and also you have the opportunity to have this here at the school. Why not?
Will the Mamaroneck School District move forward with a school-based health center? The only sure thing is that more debate is on the way.
I would just like to acknowledge our producers, Philippa Wharton and Shayla Navarro, who put that video together for us.
Thank you, Mike. Before we meet our guests, just a reminder that we invite you to join the conversation. Ask questions or make a comment. You can call, email, or tweet. The contact information appears at the bottom of the screen.
And now to our guests. Our guests are nurse practitioner Maggie Clouet, who's the school district's coordinator of school nurses, Dr. Deborah Gerson, who's the medical director of Open Door Family Medical Centers and school-based health centers, Jeannie Spano, Mamaroneck School Board Wellness Task Force member, who has children at Homix and Mamaroneck Avenue and is involved with the Mamaroneck Avenue School PTA. And finally, Wellness Task Force member Javier Guzman, who's the board president of Padres Unidos and a member, a parent of an MHS student who also attended Mamaroneck Avenue School. Welcome to you all.
Thanks.
So our purpose tonight is to have a friendly discussion. There are different points of view, I think, represented here. And as Maura said, you folks watching are encouraged to call in or tweet in or email. We already have some, and we'll get to those in a minute. But I had a question first for Dr. Gerson, and that is the video. Did it accurately portray Open Door?
Yeah, I think that was one of our earliest school-based health centers. It brought back nice memories of when we first started, and it definitely accurately portrayed the kids' comfort and ease with seeing the practitioner. Those were two of our earlier practitioners as well, who had a great relationship with the kids and the families. I think you can see in the video how comfortable the kids were in coming to see them and seek care there. And you didn't see their relationship with the families, but those two practitioners had excellent relationships with the families as well, and really became part of the school tapestry.
And that center is in Portchester?
That's right, that was Portchester.
And how long has it been there?
That center was opened probably 2008, that center.
Okay. How about we go to an email or a tweet?
Okay. One of the first questions we got was from Laura, wanting to understand what happens if her child is sick. Does she bring the child to school not knowing whether the child's contagious or not, or does she keep the kid home and bring him after, really was confused about how it works.
Okay, so I'll answer that question. So if the child is enrolled in the school-based health center, and of course all the children that we'll be seeing are going to be children that are enrolled. They'll opt in.
So it's optional.
It's optional.
It's not for every student. And by the way, this, if I understand this correctly, this is only now for students of Mamaroneck Avenue School, not for children in the community who are not in school or going to a different school.
That's right.
Okay.
That's right. I mean, the school-based health centers, just as an aside, and I'll get back to that, really become what that district and that school and the community who are involved in that school want for the school-based health center. We are mission-driven and want to be part of the school community. So if a parent is an opt-in, they'll first always go to the school nurse. That's always going to be the first triage, the school nurse. And the school nurse can make the decision whether that child is fine, can go back to class, or whether they need to see the school-based health center provider. Depending on what's been worked out with the school nurse will either contact the parent and say, your child's here, do you want them to see the provider in the school if they are registered, or do you want to come and pick them up if they have their own provider? They can continue to see their own provider. We communicate with their primary care provider on the outside. So that would be, you know, it really would be a lot of communication with the parent. You want to come and see the child, have them seen with the nurse practitioner with you. Without you, we can give you a call. Whatever that parent wants and whatever the school nurse and the school decides.
Okay. Another question from our viewers?
Along those lines, Peter wanted to know that from what he'd read or seen at another facility, or actually from, he learned that the task force learned from Open Door staff that Monday mornings there's sometimes a very long line of kids hoping to be seen. And he wanted to know, would sick students, again, be taken directly there by their parents, or again, sent to the classroom with peers and then sent out to the health center? You know, it sounds like there's a concern about these kids being, you know, a kid who might be sick being with children who are not sick for any period of time.
Okay, well, again, this is their medical home if they choose to have Open Door as their primary source of health care. Same way if they were seeing their provider outside of Open Door, if their child was sick, they would bring them to the health center to be seen. They would not send them to class. They don't have to be in class to come to Open Door if they're ill. If they were in class because the parents sent them and they weren't sick that morning, but then the teacher noticed they weren't feeling well, they would send them to the school nurse, who can then make the decision, call the parent and decide if they need to go to Open Door. The parent can take them to Open Door by themselves, you know, bring the parent in just like a regular sick visit, because that would be their medical home. Open Door, though, these are nurse practitioners who are trained just as the school nurse is, so they use infection control procedures. So if a kid is coughing or fever, or they'll be masked or they'll be isolated, they're not going to be out in the general environment like they would be if there wasn't a school-based health center, where they might be in the classroom and might be till the end of the day when they go home and say, I don't feel so well, and the parent says, oh, you've had a fever, I didn't really.
But maybe you could give us a visual for people entering the building. Is there a separate entrance for the health center as compared to where the kids enter for school? Because there is commingling of healthy and ill children if they're together.
It depends on the school. I mean, if their school has a place where there can be a separate entrance, there would be. But
what would be the case here?
Often, I believe the case would probably be that parent would bring the child to the school nurse, as they do now. So I think that's another point, is that there are parents that come to the school nurse on Monday mornings, and we have lines because they want the school nurse to check their child because they're sick. So I think it would probably work the same way. If there was not a separate entrance, the child would still go to the school nurse originally, and then be triaged to the school-based health clinic.
Sure. Jeannie?
So, well, two things that, I mean, I work in a hospital, and there's a big sign at the entrance of the hospital that says if you have cough, flu-like symptoms, please put a mask on. When I visited the Portchester Open Door, there was none of that. No, but actually the entrance was right next to a classroom. So somebody coming in with pertussis that is using this as their primary care physician, I wouldn't want my child to be exposed to that person walking through the school with that
we
kind
do
of illness.
use those same infection disease.
Oh, because I didn't see any signs at Portchester when I went.
No, there's definitely signs there. There are definitely
Did you
signs.
see signs? No.
I wasn't at the visit.
Yeah.
You were there? No.
There are definitely signs. I mean, we have the Department of Health that comes in also, and especially now with the Ebola, you know, we all do have signs.
Well, that might have been after we went then.
Well, one of the other things that we've heard in researching this topic is that the Open Door is about to open a community-based health center in the same neighborhood. In fact, we got an email from the mayor, who
The mayor of the village of Mamaroneck.
the mayor of the village of Mamaroneck, who is in favor of this. He describes it as a win-win situation for the community as well as for the schools. He said that he's confirmed, I quote here, that the building located at 689 Mamaroneck is apparently in final stages of discussion and expect the open door facility to open an office on the first floor. Also, a separate pediatric office will open on the second floor. It is my understanding, he says, that both of these entities will operate under the umbrella of the Westchester Medical Center. So if there are two facilities nearby, one in the school and one in the community, is that an argument against having a wellness center in Mamaroneck Avenue School?
I would say no.
Yeah.
Well, first of all, did the mayor state what year it's going to open? Did he say that in the email?
No.
Or the letter? No.
No.
Well, I think the predictions are 2 to 3 years. Okay.
This is for the community.
That's my
center.
understanding. Yeah.
Okay.
And what would it be for
For the
one in
community.
school? For the one in the school, what would be the time frame?
The school, it depends on the Board of Ed. If they vote on it, they can move right away, I would think. I would say maybe hopefully by September if they move right away right now. Lindsay Farrell would probably be the best to answer that question. But
let's identify her for the viewers.
she's the director of Open Door.
Okay.
Yeah. And I say, if you have two medical facilities, one that just treats students and another one that treats the community, those students do not have to wait for an appointment on the community center, all right? They get treated immediately, which is that's what we're talking about, immediate response and treatment for these students. So therefore, having more seat time to be in class, so they triage them. Are they contagious? Yes, go home. Here's a prescription. If they're not contagious, go back to the classroom, maybe give them something for the pain or whatever. So I think that, having two separate ones is advantageous, especially if you're going to have a lot of people going to Open Door.
Yeah, it's actually perfect. I mean, the interesting thing about that tape was that even the negative comments or things that could be perceived as against Open Door were actually the same. We're actually saying the same thing that we're saying that are beneficial. So having the school-based health center and the community health center across the street is the perfect combination to really give the best care to the patients that would access the school-based health center. It's really the perfect thing, having a community health center and a health center in the school.
Mike, we actually have a caller.
Let's go. Caller.
So, caller, go ahead. We have a caller there?
Not a call. There's no one else from I just want to give a quick update. You can use my name that I called in. It is not going to be 2 to 3 years. What I was told is that they expect to start construction on medical offices within the next couple of months, probably within 6 months they'll be open. All right?
Thank you, Mr. Mayor.
I didn't hear. What did he say? When will it be open?
He said they would start construction in the next few months.
And when will it be open, did he say?
Soon thereafter.
Right.
Yes, not 2 to 3 years.
That was what he was saying.
There's a lot of licensing that goes into opening a community health center, so it'd be nice, but it's not the same as opening a regular.
Is the licensing different in a school-based health center than in a community center?
It's still the Department of Health. It's a state that comes in and licenses us, so.
So it would be the same process?
Except this is built already, for one thing. So it would be, you would still have to be, the Department of Health come in and check to make sure everything was up to grade, but it wouldn't be the same long process of initial licensing.
There's actually a question that was emailed in about the space at Mamaroneck Avenue School. Is there space that you have in mind? And then the question went on to say that the New York State Department of Health guidelines recommend dedicating 1,500 to 2,000 square feet of space for an SBHC. And Tina wants to know how these guidelines would be met without compromising educational objectives at a school that seems to have a continuing growing population. And what is the plan for the future if the level of enrollment growth continues?
The Mamaroneck Avenue School got an expansion not too long ago, did they not?
They did get an expansion. However, the kindergarten classes that are in that expansion and the first grade classes are all at 23, 22, at least 22, 23 plus kids per classroom. Plus the dual language program, which has 24 to 25 kids in each of its classes, is now going K1, 2. It'll be those 3 years next year. So it's just big. And per square footage, we have the least amount, you know, per kid out of all 4 elementary schools.
So your point of view would be there's not space?
No.
Okay. Javier?
I would say, did anyone measure the Portchester space? I would think, does it have to be 2,000 square feet? I would think it would have to be an office, maybe a waiting area, a bathroom, and something to lock up medication. So, you know, how much space do you really need? I mean, how much space does the nurse's office have?
Not 2,000 square
No,
feet.
right? Okay.
Well, the 2,000 square feet was in the articles that we researched on the task force.
Right.
That's what
The
they said it
Department
had
of
to
Health
have.
guidelines?
Guidelines said
Yeah.
that.
I think the school board would have to look at that. I don't think space has been determined yet as to what it would be. And they would have to look at those guidelines and see if that was available. I don't think that's been determined.
Has there been I'm sorry,
I
Mike,
just
but-
want to ask, is that a deal breaker then, if the space is not?
It could be. I don't think that, you know.
Except that you're talking about added enrollment down the
Well,
road.
I think it's increased. I'm not sure of the exact number, but it's 24% in the last 3 years that MAS has increased.
So that adds more students per class?
Per class.
We also had a question about, has there been a calculation by the task force of the cost to the district? In the video, we heard that, I think it was custodial fees and utilities would have to be covered by the district. There's a question about, what about a security guard during off hours? And there were also, I guess what you would call opportunity costs, the use of the space elsewhere. Has there been any calculation of the cost?
No, there hasn't been. Not by the task force. That was not
There
a
would,
charge.
there would be no cost to the district. And the lights would be on anyway. It's utilities, paying for the lights. The children that would be seen are children in the school. So I'm not sure the security guard question what
Why
that.
would there be?
Well,
need?
if you're
Exactly
opening
right.
another
Right.
entrance, you would have to have a security guard or at least a greeter.
Well, the
we have
ques-
one entrance open for
The
security
question
purposes.
was, before and after school, when students are in the building for extracurricular activities and access is currently restricted, don't you need someone, there at the door?
If the clinic was open, it does. Again,
So you'd
the
have to
district can
would
can
determine the
decide
hours.
that what hours it is.
We currently keep the doors locked until 4 o'clock because there are after-school clubs. So once those students are done, then they don't buzz you in anymore. So if the clinic was to be open past the 4 o'clock hour, then that would change the game. We would have to have somebody there greeting people.
We have another caller.
Caller, go ahead.
Is our caller there?
Yes, I'm here.
Okay.
Yeah, one of the things I'm hearing is a lot of talk about Portchester. And Portchester and the health clinic and the school district are Latino friendly. That's not the same case here in the village of Mamaroneck. The health clinic and Open Door is a great idea, great institution, and it would be good to have it here in the village, but not as part of the school district. Issues of privacy concern me. So as a social worker, I have represented parents who were called by the school district and the teachers and the social workers because of and called by protective services, child protective services. A clinic attached to a school is going to those calls and put more Latino families at risk. So I believe the connection should be private and where confidentiality is respected. I think it's a big mistake. I'm a Latino. I have lived here over 36 years. I'm a professor. I'm a social worker. And it is unfair for Latino families that are poor to now open up their families and their medical records, which no matter what they say, we'll find out. And Open Door should operate independently outside of the school district. You know, families should take their kids to psychiatrists that are separate from the school district. Rich people take their kids to private institutions. They don't take them to where the school district would know what's going on.
Okay, thank you, caller. Does anybody have a reaction to that?
I guess I'll ask the doctor. Do they have to sign a waiver between the school and Open Door for that information to be passed back and forth?
Yeah, I'm not quite sure I understand. I think he was saying that the computer system is tied in with the school system and that all the information is released, which is not the case. We have a separate electronic record that is Open Doors record. We follow HIPAA regulations. So the information, I think that's what I'm understanding he's saying, is not something that's shared with the school district.
So the computer systems are not interconnected?
No, they're not interconnected.
And privacy is respected?
Privacy is absolutely respected, yes.
But he was concerned about child protection services.
Yeah, I wasn't sure I was understanding that part.
No,
did you understand?
No, I didn't, but I
Yeah.
did hear him
But
referring to that.
I do respect that, you know, the question, and I do feel, yes, people want their privacy respected. We're all very worried about privacy, and we're very, very conscious of that, of respect and of following the HIPAA regulations.
Perhaps it's a shared space between the school nurse and Open Door. If he was talking about, I think, mental health issues and maybe being worried about if there's another kid, like my child who's not enrolled, going in the room next to him with the school nurse, perhaps they're overhearing what the other child is saying to the doctor or the nurse practitioner, and perhaps that could be something that he was speaking of.
Possibly.
Javier, you and Ginny and Maggie, you're on the task force,
We
right?
were.
We were.
But you were not charged with making a specific recommendation to the board.
No.
And you did issue a report in
Yes.
January
Yes.
this year? And what's, now there's a needs assessment being conducted?
That's what the board had stated.
And that's not, you're not doing that?
No.
And I'm not sure that there is one being conducted yet. That was the next step. The board has not taken that step yet.
Okay. And that is to determine if there really is a need
It
for...
would be more professionally done. I think we were more of a community-based task force to start, and the main charge was to educate the community as well as the board about school-based health clinics. There was a lot of misinformation out there. People were asking questions that, you know, we found out a lot about that weren't true. So that was our main charge, and then the second was to see if there was a need at Mamaroneck Avenue. But it would have to be a little bit more professionally done,
So
and
the
the board has not
statistics
made
that were in the video and what was in your report are not sufficient to justify?
Well, I wouldn't say that. I mean, there is a need, absolute need, to have this service in Mamaroneck Avenue School based on the socioeconomic status of students and families that attend that school. It has also to do with education. I mean, people say that it's not education, it's health. You are educating students about their health when they go in with an asthma issue to an Open Door doctor. And you know, it all comes down to not just educating those students, but educating the parents, just like the PTA does with their parents, just like Padres Unidos does with our parents. It's about educating parents. What do you do, you know, with an unhealthy child? As a matter of fact, they have stuff like Open Door already here in Mamaroneck. They have the mindfulness at Chatsworth. They also have the guidance center in the Hommocks Middle School. So there are already school-based health clinics, so to speak.
But they don't provide treatment, do they?
Yes, they do.
They do?
Absolutely.
Well, the guidance center does, but I think that Mamaroneck Avenue School does a terrific job, as I said at the board meeting, of educating our students as far as nutrition goes. And we do the mindfulness as well. We have DARE, we have the drug and alcohol. We just received a grant to have organized soccer games next year on the playground. We're the only track that gets cleared in the wintertime because we make our students walk the track at least once. We have our Crunchy Carnival coming up next week, which is just a 2-hour night of nutrition, reading labels, and it's in Spanish and English and all. It's very expansive now. And our garden is probably the best in the district, if I can more.
Several plugs there.
So our garden, you know, the kids all plant the seeds and they grow them and they harvest them and they have salad celebrations and they make soup and they taste all different things that they never would have tasted before. And the families actually tend the garden in the summer and are allowed to take the vegetables home with them. So it encourages them for that.
We have a 3-part question from Conchetta, and so I'm going to do one part at a time, which is, The concern that why Mamaroneck Avenue School as opposed to Central School, which has the highest rate of student absences, at least according to her, why isn't it being considered for a school-based health center? Or any of the other schools in the district, for that matter. But she specifically asked about Central.
Well, can you, I mean, as we talked about, you want to
I would think it's because of the 47% free lunch. Kind of dictates that it could support an open door clinic at the school, as opposed to only 15% at Central. So I think that's part of it. I mean, they do have to support themselves. They're not taking money from us in that sense. So they do have to support themselves. So I think that's the initial part. But there's no reason why the Board of Ed can't make exceptions, why Central school students can't maybe come over to Mamaroneck Avenue School during certain times. It's up to the Board of Ed.
Let me go to part two of her question. It starts with a statement that the burdens on parents of traveling to existing community-based health centers, Port Chester, Ryan, New Rochelle, has been cited as a reason to locate an SBHC in Mamaroneck. Yet our district's current transportation policy is that students who attend private or parochial schools in these same communities are reasonably expected to travel up to 90 minutes each way via public transportation on a daily basis to get to school. It seems inconsistent. If the burden is transportation-based, have transportation-focused alternatives been considered? Maybe public transportation passes or an open-door operated shuttle bus? Have those kinds of, this is Conchetta's question.
Okay, I'm a little confused.
Okay.
She's talking about transporting.
Providing transportation to other facilities.
To other facilities.
Right.
All right, to existing facilities.
Is that something that the task force considered?
That wasn't the task force charge.
No. Okay.
You know, and I think the gentleman that was on your video was a doctor at the New Rochelle clinic, and he said that they offer vouchers for families that need to travel.
I think it's important to recognize the parents of many of these low-income children don't have the flexibility in their jobs. And it's not just low income. I don't have flexibility in my job.
I think that was a point someone made in the video, that a lot of people don't have flexibility in their jobs.
But for these parents, for myself, I'm secure in my job that if I did have an emergency and had to leave, which would be difficult for the health center, I would not lose my job. Not everybody has that security. And I think that's a big stress on a family as well. These are families that work in these type of jobs where, many of them, where they can lose their job. And they're very worried. They're worried about feeding their families. And that affects the entire family.
Would a school-based health center in Mamaroneck Avenue School attract more people to that neighborhood?
People are coming, no matter what.
Yeah.
But I think
People are coming no matter what. We don't have a school-based health center, and look at the rate at Mamaroneck Avenue School. In the last 5 years, I think it's something like 22% increase in students without a school-based health center.
Okay. So you don't think with a school-based health center that it would increase more? I think
not
it
sure.
absolutely would. It absolutely would.
Yeah.
I don't think so.
We have another email question, I'm sorry. And there's, this is a question to those who are opposed to the school-based health center. Based on the facts, what do we lose by having an open door office or services available within the school? And for those who are in favor, how would this help families not lose time away from work and children away from classes? So keeping people at work and keeping children in classes. I'll let you identify yourselves as those opposed or for.
Well, I just think two reasons that are strong in the opposition is the sickness and bringing germs into the school. You have not convinced me. I don't. These primary care physicians are there. That's what these kids are going to see. So if my child has chickenpox, pertussis, anything contagious, I'm bringing them to White Plains to go to their physician. Now you're bringing them into the school to go to their physician. So I don't see how anybody can state that you're not introducing more germs into the school, because you certainly are. Anybody that may have stayed home and went to a different doctor is now coming to school sick. Plus the district has a policy where you have to stay home fever-free 24 hours. Now these kids are all going to school with fevers. I mean, whether it's a virus or not, I understand most kids have viruses. And I think the security thing was really the other major concern. It's just that Mamaroneck's doors, because we have a free breakfast, the free reduced lunch, a lot of the kids eat breakfast there. We have kind of an open campus until 9 o'clock when the doors. And right now, we don't really have any control over who is in the building at that time. I mean, this is just going to add to not having control over who's coming in and out of the building, especially before the hours. You know, we don't have anybody keeping track of who's in and out.
And so for those in favor, how would it help families not lose time from work or children not miss school? I mean, if you're sick, you're not going to be in school. I think that's partially where she was heading with this question.
First of all, the doctor would, for example, someone who comes in with a throat issue, problem, doctor would swab the child. They can tell at that point if it is contagious or not, at least the initial part, okay? Maybe give something to the student to soothe them, and then when they're ready, they can go back, as opposed to calling the parent, come pick up your child, take your child to the doctor, okay? Now that child has lost seat time, and that's the important part. As a matter of fact, I think in the video, they were talking about asthma, and that is one of the things that had increased. They increased seat time 3 days for students who had asthma. So something like that, 3 days, that's a lot of hours school time that this child did not miss. So in favor, yes, seat time is very important for education.
But how do we allay, or how do you allay the fears of parents who say a child could come in with something that's contagious?
But the child to me does come in with something that's contagious. I think it's beneficial when that child can be treated then for something contagious. The child appears in my door as a school nurse and is coughing, and it could be just a virus, like Jeannie said, or it could be pertussis. No one from Open Door is going to send a child with pertussis back into school. But now if I have somewhere to send that child, somebody can determine, do they want to do a culture, or do they want, or is this just a viral cough?
What do you do now?
Right now, I call the parent, and there, as Javier said, there's seat time loss. So that child has to go out of the building. The parent has to lose time from work to get treated or to get looked at. Now, could have been a virus. Now, that kid might have lost the whole day compared to not. Or the child does have something serious and goes home.
So you see the Open Door as something that would help you to help these kids and help these parents.
And ultimately, to what our job is as school nurses is to keep these kids in school when possible.
I think our school nurse does a great job of that, though.
She does an incredible job.
She's a nurse practitioner by trade anyway, and she handles emergencies, and she is able to. I mean, my daughter, for instance, has been in her office probably every day for the last 5 years, and I've gotten called maybe 3 times. So I think that she knows when a parent needs to be called, and even when a parent needs to come home. I mean, I've had to get her maybe 1 time out of the last 8 years.
I'd say let's look at the other end of the spectrum. A sick child that has to go home. I would think now the school knows when they can come back, so they're not contagious to other students. They don't come back prematurely.
But are you clearing them to come back? Because I know you're giving them a prescription, but you're not guaranteeing that that family who now doesn't have insurance is going to the pharmacy to pick up that prescription, because you don't know, and maybe they don't have the means to pay for it. How do you clarify that?
I mean, that would be the same case anywhere, but people do often have that worry about kids being exposed, but we know that doesn't happen. That schools with school-based health centers, kids are healthier. There's less absences in schools with school-based health centers. If kids were being exposed to things, there'd be more absences, and we know there is less. Well, I do think actually the nurse practitioners in the school-based health centers have a lot of communication with the parents, so they actually do my provider would never call and say, did you pick up the prescription, how's the child feeling? Our providers do that. They do that, and they communicate with the private physician if they have a physician on the outside. And they would see them, usually they'll say, come back and see me, or clear them for gym. So they do communicate with them. Communication's key with the parents, with the teachers, with the community. with the outside providers. They do that, and there is just no data that shows that kids are sicker in schools with school-based health centers. It just doesn't happen.
But there's not a lot of data that shows that they're not. I mean, you know, and
We
now
have years
especially in
of
the world with people not getting vaccinated and children, normal, you know, people that have insurance don't vaccinate their kids now.
Well,
So you're increasing your risk of
At
getting
Open Door,
these more.
everybody's vaccinated.
For those people who are just tuned in, perhaps, you're watching a special edition of The Local Live, and we're talking about the proposal to locate a health center in Mamaroneck Avenue School. And we have 4 guests, but we also have a caller. Caller, go ahead. You're live. Caller, go ahead, please. What's your question or your comment?
My comment is about the clinic Open Door, in Mamaroneck Avenue. Es en español que quiero decirlo, por favor. Estoy de acuerdo de que la clínica Open Door en Mamaroneck esté abierta para facilitar a la comunidad hispana y de bajos recursos los servicios que ustedes ofrecen. Es más fácil, más rápido, y los niños estarían más tiempo en la escuela porque estarían menos enfermos y se ahorrarían tiempo a esperar que el médico dé una cita, porque ustedes resolverían el problema de una vez y así todo el mundo estaría contento.
She's saying that she's she's in support of the open door proposal because this is going to be easier, less expensive, and it's definitely going to save time. As kids are not going to lose classes. They won't have to stay at home, and they will be able to dedicate more of this time for her school chores. She's also saying that this proposal will help parents to get to home. I'm sorry, to let kids to get immediate access rather to wait and go to the doctor until wait for an appointment, which they struggle.
Okay, so that was a comment. We do have a question here. Is it from Lynn? Is it true that the SBHC proposed is only for Mamaroneck Avenue School? And even taking that, is it for families at Mamaroneck Avenue School, even if their children may go to Hommocks or the high school?
It would. Right now, I think they're looking strictly at Mamaroneck Avenue School. And
Students at that school.
Only the students at that school.
Okay, and we have yet another question.
Go ahead.
That was exactly the question we just asked about whether siblings could also go. So.
Okay. Is there anything that we haven't addressed on this topic that you'd like to, any of you would like to
I would
speak
like up
up
to just
about?
say that the comment in Spanish, I think it's important that the mother use the word struggle, because I think it's important to recognize it is a struggle. A lot of the parents in the community are struggling every day to keep their kids healthy, to get them educated, to put food on the table. And a school-based health center, whether it's in combination with a community health center across the street or standalone, if we can help parents in our community to meet the demands of the daily struggle, just trying to have their kids be successful, they should have the same opportunities that we all have. I think it's important, and that she used that word struggle, that we recognize it is.
Okay. Jeannie, you wanted to say something?
I just think for me it's become more about, not about access, but about convenience. I think that there's plenty of access in this area. We have 3 hospitals within 10 miles. I think that, with an Open Door Community Center, which I think would be a wonderful addition to our community, I think that's where we need to educate the whole family. It's inconvenient for me to go to my pediatrician because they don't take my insurance around here either, but I do it. I think that that's what this is becoming. It's becoming more about just making it local and making it in Mamaroneck School so that nobody has to take off from work or go anywhere. I don't think it's about actually getting the health care anymore.
Javier?
I see it differently. I see that it has more to do with education. Back in 2010, I think it was, 11, 10, graduation rate for Latino students was 71%. The rest were not graduating. Now it's 91%. Why did that happen? Padres Unidos got involved. we work with the school, right? So if I can get more seat time for these families, I can see that graduation rate raise up.
Seat time meaning student in the seat in the classroom.
Instead of being sick, or not be sick and still sit at home because they need to be checked out anyway.
Yeah. We have a caller, and this may be our last call tonight. Caller, go ahead, please. Caller, you're live.
Hi there, this is Zoe from Hispanic Resource Center. I just wanted to, hello, can you all hear me? Hello?
I'm sorry, could you speak up?
We're waiting for...
Hi there.
We can hear you now, thank you.
Okay, great, thank you. So I just wanted to make a comment that in New York State, all children are eligible for public health insurance based on income. And so if a child was seen at the school-based health center and needed to fill a prescription, they would actually most likely have insurance, and so they would be able to access the prescription. So I just wanted to make that point.
Did you identify yourself before? Okay.
Zoe Cologne from the Hispanic Resource Center. Obviously, I would have a lot more comments, but I really did want to get to the point around access to prescriptions, because all children in the state of New York have access to health insurance, regardless of documentation, immigration status, whatever. It's based on just being a child under the age of, I think it's 21 or 18, depending if you live with your parents, and you do have access to health insurance as a child in this state. So you would have access to prescriptions.
Thank you, Zoe. There was actually a question emailed in about if they have insurance, why don't they also have access to the health care? Else, going to a physician locally.
I mean, it's not just about convenience. It's about what is the best model for providing health care to the community. And school-based health centers are the best model. We have many parents who have private insurance, who have state insurance, but many of the parents choose who have been in schools with the school-based health centers to see our providers, because they realize that access, that comfort with the provider, that relationship, and that becoming part of the school tapestry really is so important. Because that same message you're giving at home, I heard one of the parents at the board meeting was saying, well, the parents need to teach their kids this. Exactly. That's why I'm saying a lot of what we're saying is the same thing. We want the parents to teach their children, and then we can give them reinforce that same message. They're little now, but you want, as they get older, that message to be reinforced when they're young, so they understand and they can go out and learn to advocate for themselves, make good decisions, and be really good health consumers.
I'm wondering if this health-based center or the health center does get established, and down the line, 1, 2, 3 years, conditions change. The school has to accommodate more students. They can't build on, or some of the things happen that you've raised, some of the fears that you've raised actually occur. Can then the center then be closed? Is there any reason why is this like a 10-year contract that you would sign with the school?
I think flexibility and communication is always important. That wouldn't be our wish, because we are very mission driven. Our providers, as somebody said, we're not there to make money. We're really mission driven, and so hopefully there would be something we could work out. But Open Door is very flexible.
Okay. I said that was the last caller, but I'm wrong. There is another caller.
That's right.
Go ahead, please. You're live on the Local Live.
Please speak up, caller, so we can hear you. We're waiting for the caller. Please speak up. No? It seems like we lost the caller. Oh.
Hello?
Yes?
We can hear you. Go ahead, please.
Well, maybe we should
I'm not sure that we're having some technical problems, but thank the caller for attempting to call. It's our fault that we can't hear you. Maggie, perhaps you have the last word here.
Well, I've had experience, I think, in both as a school nurse working in school-based health clinics and as a nurse practitioner working for the school-based health centers. And I just want to add that the relationships that are built, I think, is something that a lot of people are not aware of. And the school nurses in the building, to have a medical team, a collaborative team, would benefit the kids, and I've seen it happen, and I know how it happens, having been on both sides of that fence. And the people from Open Door, from whatever agency, become part of the family of the school, and that's an important part for kids, and the kids trust these providers. I've seen that, so I see it as a win-win.
So the next step is that it's up to the school board to do a needs assessment?
I think that that's what they determined, that they will want it.
The school board had said at the last meeting that they were going to have another meeting about
right.
where to go first, but the recommendation was to do a formal needs assessment, whether that comes from Open Door, who is the facility that's proposing it, or whether it comes through the school district. That is where the decision is.
Are there other conversations that are being continued through informally, yes, and we can do more programs like this, but are there other conversations that are being set up around the district to keep talking about this? And
I don't think anything formally.
Keep informing our parents,
Are there other providers being considered? That is actually a question that came from like Montefiore, New Rochelle, as opposed to Open Door, or is it purely an Open Door discussion?
At this time, I really don't know.
I think Open Door was the only one that had a proposal.
That actually came to the district.
Okay.
That's
Well, I thank you folks for watching, and I thank our guests for participating.
Thank you.
And we can do this again, I think.
Certainly a lot to talk about.
Thank you for a very civil conversation.
Thank
I think we touched on lots of issues that have been reported in the paper. And that's it for this week's what?
I was going to remind people that they can watch this again by going to the website lmctv.org. That was all.
And also, this same program is going to be repeated, I believe, on every night at 7:30, and you can watch this whole program again. And if you have any comments or questions, you can email us at thelocallive@lmctv.org. So join us next week. We're going to have a roundtable discussion on the do's and don'ts of social media. I'm Mike Witch.
I'm Maura Carlin.
Thanks again to our guests, and we'll see you next week.
Thank you, Maura.
Tell us what you think. In person, over the phone, online. Watch and hear yourself on TV. You tell us, we air it. This is The Local Live.